right, now we're going to have our patient and Van come on in, and we're going to fit her to the CPM. So we're going to have her again. We just sit in just the way that we explained. We're going to have her square herself in the chair, and we're going to have her lay her arm into the orthosis like that. Now, right off the bat, I want to go ahead. She has small arms. We want to go ahead and kind of get her at least a little bit comfortable. Now we want to ask her to square herself in the chair and to sit all the way back. Now, we're going to go ahead and slide that off armrest back, and we'll come back to that in just a second. Now, the first thing that I typically want to do is make sure that the patient is comfortable with the angle of the back of the chair, okay? Typically, where I have it is the most comfortable spot. However, if she would be more comfortable, we can lean the chair back or we can lean it more forward. Now, I don't think she would be more comfortable leaning forward, but what I'll ask her to do is to lean forward off the chair. This knob here, right along the side of the chair, if we unloosen that, we can scoot back or we can move forward. Now, we can't lay back. It's got to be far enough that we're not going to bring the patient into the motor. So we are limited a little bit here, but we can get the patient to a comfortable level, either back or more forward, and then we want to lock this into place. Now, it has to line up at a certain point for it to lock into place, and you want to make sure that you tighten that knob really good and that this isn't going to come loose and they fall back. So I'm going to ask Ann to go ahead and sit back, and then I'm going to check with her to find out if that's a comfortable angle for her. And it is. So we're okay here now. Now, we're going to go back to, remember our 5 settings. Now, the number 1 setting down here, again, we're always going to be in the 30 to 50 degree range. And for Ann, at the 40 that I typically start at, I think she's going to be fine. So I'm going to leave it there, and then I will come back to that at the end here. We're going to move on to number 2. Now, number 2 is the most important setting on the machine, and it is going to be relative to the patient's height. What we want to do is we want to line up the pivot point of the motor. So basically, the pivot point of the motor is where the number A is on the back here. We want to line up the pivot point on the motor with the shoulder socket, or the pivot point on the shoulder. Now, to do that, couple different things that need to come together. Typically, if I go from the top of the motor, I should be able to line up with the top of the shoulder. Now, keep in mind, if you're setting up a patient after surgery, there's going to be a lot of bandages on there, and that can be sometimes hard to tell, but you can usually get an idea that the top of the motor and the top of the shoulder line up. Even if you have some bandages on there, you just got to keep in mind the thickness of the bandages. The other thing that needs to happen here is we need the patient to be even shouldered and comfortable. And if we have one, we should have the other. So, so what I'm going to do is come around from the front. I always take a look at the patient to see if they look comfortable and even shouldered, and right now she does not, and part of that is because of the off armrest. So I'm going to put this at a comfortable level for the patient. Is that comfortable, or would you like it a little bit further down, a little further up?
A little bit further up.
A little further up, right there. Okay. Now, I always explain to the patient what I'm doing with the A motor. I want her to be comfortable and even shouldered, and I want to line up with the shoulder socket. So I also need feedback from her that she is comfortable and even shouldered. Now, what I'm going to do, because we're setting her up before surgery, I can move that up and down, and I'm going to show you right now what is wrong, what is the wrong way and what is the right way to have that A motor. Okay, so what I'm going to do is I'm going to come around here and I'm going to loosen the A motor. Now, anytime we loosen this A motor knob down here, we have to hold on to this. If I loosen this and I don't have a hold of this, it's going to drop. And if you have the patient's arm in there, that's going to be bad. Okay, so what we want to do, and I'll have you come around to the front of her there, I am going to lift this and I'm going to keep coming, and you see there, I am not only above her shoulder here, but you can tell that we're bringing her arm up into a shrugged position, which is not good. Now, if I keep going down, now I'm drooping her arm down, and that is also not good. So what I'm going to do is I'm going to find a comfortable medium, and I'm going to lock that into place. And now I'm going to take a look at her from the front, and I'm going to ask her, do you feel comfortable and even shouldered? Okay, don't want to droop you on one side or lift you. I want to keep you comfortable and even shouldered there. Feel okay there? Okay. So the patient feels okay. If I go off the top of my motor, I'm going to line up with the top of her shoulder, and my pivot points are going to line right up as well. So I'm happy with this, and for her, this just happens to be 30. Okay. So some techs will make a note of this setting so that if the patient has a kid or they in moving it, they get that out of adjustment. They'll note it somewhere so that way they remember that this particular patient, Ann, was a 30 on the number 2 setting. Okay, so we've got the number 1 setting, which is pretty standard. We just set the number 2 setting to Ann's height, okay, to the line up with her shoulder joint. Now our number 3 setting is the length from the pivot point on the shoulder to the elbow. And you can see here for Ann, that is way too short. She has short arms, so this right now is much too long for her. So what we're gonna do is we're gonna flip this lever for number 3. Now when you go to make this adjustment, if you just try to pull or push, you're gonna jerk the arm. You have to release the weight of the motor by lifting here, and then we can gently move that in, and then we'd lock it back in, and then we'd have Ann position her arm properly in the orthosis, okay? Now, what we want here on this length, I don't want to jam her shoulder up like that. I don't want her to have to droop down to get her arm in here. We want it to be a natural position. So I think right about there is going to be good. This back piece, and I always explain to the patient that this back piece here is just a backstop, if you will. It keeps the arm from going backward. Her elbow will move in here, and that is okay. The important part is that we keep her in this orthosis here, into this cuff here. And to do that, sometimes patients have to grip near the top of the handle, okay? This will move so that we can angle it for her arm. So we don't want it like that, digging into her arm there. We don't want it down there because it's not supporting the back of the arm. We want it angled with her arm, okay? Now we want the elbow, the back of the arm to rest against the pad, and we can unloosen number 5 over here, right next to her, and now we can adjust this. We don't want it to bring her away from this. We don't want to jam her thumb. We just want it at a comfortable level for her to be able to be against the backstop and grip the handle, and then we can lock that into place, okay? So looking at her, that is perfect. And again, all we want to do with the patient is adduction and abduction in a normal manner. So we're going to go ahead and explain to the patient that they do need to wear this strap. It's going to help hold them into place so they can reach with the off arm, they can grab that strap, and then they can just touch it to the Velcro, and they can leave a flap to grab for it when they want to get out, okay? So we look good here.